Good afternoon. Welcome. I'm Dr. Jill Brooks, Director of Education for First Healthcare Compliance. Here at First Healthcare Compliance, we are focused on helping healthcare providers and billing companies around the country save time and money while reducing compliance risks with our single source solution. Each month, we bring different experts in the field to discuss a variety of topics relevant to healthcare businesses. We are so pleased to have Ray Ribble, Managing Partner of All Medical Solutions, joining us today for our broadcast. Ray has overall responsibility for managing and directing All Medical Solutions healthcare business activities in Southern California and across the United States. In addition, he is on the board of the parent company Fusion Systems and oversees operations in Tokyo, Shanghai, Hong Kong, and Singapore. Ray is actively involved in accelerating growth, implementing best practice guidelines, and maintaining customer service levels within each market. Ray and his team just completed 3+ years supporting the HITech program as a certified service provider to healthcare providers in Southern California. As a byproduct of that interaction, they developed a PHI monitoring solution that is now being used throughout the U.S. Ray?
Okay, thank you very much, Joe. I appreciate that, and good afternoon or good morning to everybody there. Again, my name is Ray Ribble, and I'm the Managing Partner with All Medical Solutions. I'm going to walk you through a number of slides today and talk to you a little bit about our experience with monitoring PHI Access, and at the end, I'm going to provide you with contact information. So as you're listening, if you have questions, write them down. My contact information will be there. Feel free to just send me an email, make a phone call to me, let me know that you were one of the participants on the event today, and I'm more than happy to reach back to you and provide you with my expertise or one of the senior members of our security staff and share with you our experiences and our answers. So with that, let me jump in. The agenda for today is obviously to introduce ourselves. Let's talk about PHI. Let's talk about the monitoring options that are out there. I'll show you some case studies of our experience across the United States, talk about some of the benefits and decisions that are available to you and that you will have to make if you haven't made them already, and then we'll summarize everything. So as Jill introduced, I am part of a company called Fusion Systems. Fusion Systems entered into the healthcare business about 4 years ago. We acquired a company here in the United States. Funny enough, I started my company in Asia back in 1992 with my partners. We were all Americans working overseas. We built that business, so that's why you see all the Tokyo, Shanghai events. But ultimately, the desire was to come back to the United States and build a business here. Today, we're working with our product and with our services. We've delivered systems to over 1,800 providers with the HITech program. We learned a lot about what works and what doesn't work, and so we have a lot of insights there. And as you can see, the AMS SPHER product is what we're focusing some of our energies on as it relates to the PHI Access. Let me start with something that's meant to be a little bit of a chuckle. Healthcare perspective, if I take 2 aspirin, if I drink 8 ounces of water, I eat an apple a day, it's supposed to keep the doctor away, and it results in a healthier rate. At least that's what I'm told, right? Let's apply that to a medical office, especially in today's world. If you do your security risk assessment, if you follow all of the HIPAA rules, and if you're monitoring who's looking at your PHI data, the result is supposed to be a safer office, which then results in a safer patient. And the question is, are we doing this? And if so, how often are we doing it? And how well do we understand the data that we're looking at? And that's what I want to try to provide some insights to for today. So as you go into this world and you start to bring your ePHI online, you were a member or a participant in the HITech program, or maybe you were a specialist and you brought that system in at an earlier stage. Some of the questions that you needed to ask yourself and that you should be asking yourself are on this page. The first thing you want to do is take a look at your own office and say, what information systems am I using that generate PHI? It's not just the EHR system. Some organizations that we come across are using disparate systems. So it could be practice management, it could be a PAC system, it could be a number of different systems that you have in your office that are responsible. It's not just one. So take a look at that and make sure you know what those systems are. Next, have you done your security risk assessment? And if so, are you keeping that up to date on a yearly basis? The next one is, of course, the risk management program. So as part of your policies and procedures, which I have down lower, are you constantly going through and looking at it from a risk management perspective? The last thing, or the next thing I want to urge everybody to pay attention to isn't just what you're doing, but also the third parties that you bring into your office. PHI and monitoring PHI isn't just about your staff, it's also about third parties that you allow in your office. So as you bring what the security around those systems are. And then from the services perspective, your service partner, have they signed a BA with you? If they're accessing your data, if they're storing data for any reason, where is that data being stored? Isn't it being stored in a safe place? Is that storage facility, if it's a data center, is that HIPAA compliant itself? And I know that's a nuisance, and I know it's a lot to think about when you're trying to do patient care, but unfortunately, these are the constraints that HIPAA puts upon us as part of these rules. And last but not least, is that in your office, developing and implementing sanctions policy. What I mean by this is not fining your employees, but if you break a rule, the government says they're going to fine you. They're going to fine you a lot of money. It could be $500, it could be $50,000. If your employees aren't following the rules that you established in your business, what are the sanctions that you have for them? Do they get written up? What happens when we break a rule? Most people don't think of business that way, but I think you need to start at least giving it consideration as part of how you manage your PHI. So where is the PHI? In the old days, it was on the wall, in the back, and all the beautiful colors, all the beautiful codes, and everybody knew how to use that system. But over the last 3.5, 4 years, we've made this big move from paper to digital. So it's in my EHR, it's in my practice management. It could be a lab system, it could be a clinical system on an off-site. It could be on-premise, it could be off-premise. So there's a lot more going on out there than just what we used to manage. In the old days, I locked my door, I set the alarm, I went home, and I thought my data's safe, reasonably safe. Today, my data's in a live environment somewhere all the time. Even if it's on-premise and I'm hooked to the internet, there's the potential for somebody to access that data. So building the firewall, putting in the policies and procedures to protect that data is extremely important for your business, for your practice, for your reputation, and for your patients. So what type of limitations exist in terms of physical safeguards? You still need to lock the office, of course, but now you need to lock down your system. So password security, your firewall, remain that they're updating and are they storing that information on that device when they go home? If so, the next question is, who's granted access to that information? How do you know how they're using it? And then finally, it's device and the media control in terms of access control. And please don't forget disposal. How you dispose of data, let's say you have a computer system in your office that goes end of life. Well, you need to make sure that when that happens, you might erase that data, but that doesn't necessarily mean that that data is gone. So what we recommend is that you have the hard drive removed from the system and actually crushed, preferably on site so that you can see it happening, to really ensure that that data is not going to end up in somebody else's hand, or that hard drive is not going to end up on one of the medical websites talking about your organization being hacked because they got a hold of one of your hard drives. We all know those are the stories that seem to make it in the news every day. So what's to worry about? What's to worry about is quite complex. Again, I bring you back to PC, tablets, and smartphones. There's just way too many devices for you to keep track of in your office, in your facility, and the ability for your employees to log in, see data, and manipulate that data as part of their daily job. Our smartphones are smarter than ever. They're getting bigger, and it's much easier for us to read and manage the data. And anybody who's using a smartphone or an iPhone knows that I can do a screen grab, for Snapchat or whatever, and actually capture that information. How would you know that even happened? The answer is you wouldn't. You wouldn't know that happened. So if I wanted to look at 15 different files of a patient, which may look like I'm doing my normal job, and I've been doing a screen grab of each one and then passing that off to my new boyfriend who's in the biker group, well, you're not going to know about that. There's no way for you to realize that that's happening. And if you were able to look at those audit logs coming out of your system, would you be able to recognize that pattern to determine whether or not malfeasance is taking place? And typically the answer is no, because you're experts at healthcare, you're not experts at IT systems. It's difficult, close to impossible, to understand when snooping is taking place. It's difficult to know if identity theft has taken place. My point there that I bring to you is that 67% of all of the breaches that are happening in the United States are caused by internal employees. And let me drill down on that for you if I can. Of that 67%, most of those breaches occur within the employee's first 90 days on the job. So what we found in the Poneman Institute, if you want to do some research on this, the Poneman Institute issues a paper every year that you can take a look at, which will provide you with details on where those breaches are taking place, the type of breaches, what type of systems are being accessed. I'm happy to share that link with everybody after. And mostly, it's law, right? We know this. We've all seen these bullet points. God forbid you don't want to read them. That's too hard. I will make this deck available to everybody. But there's a regulatory framework out there, both from the meaningful use perspective as well as from HIPAA, that we're required to follow. And we all know that more often than not, the rules are very vague. Regularly monitor access. Define regular. Is that 20%? Is that 50%? I guess it doesn't mean 100%, but if I'm not looking at 100% of it, am I 100% sure that my data is safe, that I know who's accessing the PHI, and that I'm confident that no malfeasance is taking place? And of course, the answer would be no. It's not a court of law, but somehow when these breaches take place, the fingers are pointed at the healthcare organizations, and they're blamed for not doing enough to protect the information. So where's the disconnect? We know the regulations require us to monitor access. We probably know it's the right thing to do. Patients, I don't think that they've come to the level where they're protesting against us, are not going to come to our office. But if you do have a breach, the data supports that 60% of those patients will not return to your office. And again, I can show you some data that supports those numbers, but if the news gets out, if you have 500 records or more and you have to go out and run an ad in the local newspaper, you have to contact legal sources, you end up on Health and Human Services wall of shame for a major breach, expect your business to be impacted heavily, if not put out of business. So again, spending a little bit of money up front, and I know everybody hates to do that, spending more on IT when you're a healthcare organization, but spending that money might prevent you from losing your practice or losing your business. Not doing anything can jeopardize patient safety, and the cost of that breach, if it becomes public, is just too high for you to afford. So where does this reside? I talked about this in the earlier slide. I'd like to come back to it again. And I like, when I give presentations, I want to bring people back and forth in terms of reiterating the point. It's in your EHR, it's in that EMR, it's in that practice management system. It could be in a lab system that you share with another office. We have a number of clients who have 2 or 3 offices, and Monday and Tuesday they're at one, and then the whole team moves over to a different office on the other side of town for Wednesday, Thursday, Friday. Or they might work in a clinic on a Thursday or a Saturday, but they're still accessing data from the original site or from the cloud. So it's in sensitive applications. Quite often, it's moving around in a network. That network is not only contained within your office, but it may be up in the cloud, which means that other third parties that you're not aware of have the ability to look at that data. And you need to know you really do need to know who's looking at your data besides your own people. I started knowing if your own people are doing what they're supposed to do and are they accessing the information correctly. But for the more sophisticated and able organization, you also want to be looking at the network. It's in the cloud, and again, we'll reiterate, it's in multiple devices. What are your options? Well, the first option is pretty simple. It's what most of the market has been doing so far since HIPAA was announced, since Omnibus Rule was announced, since the HITECH program was out there. But do nothing. I can't tell you how many times I've had discussions with providers, with their staff, with the office managers who said, we've been using this system for 3 years. We haven't had a problem. Why should I spend $80, $100, $150 on security system when we've never had a problem? And, the easy question is to say, how do you know you've never had a problem? If you're not looking, if you're not monitoring, you don't know, And sometimes the answer may be, well, I don't want to know, right? That would be not a really wise decision. And if you do get audited, if you were part of the HITECH program, I keep pointing back to that because that's where my experience comes from, you're liable for the day that you attested from that date up to now of having to pay back all of the money you received in subsidy, plus all of the fines. That is going to exceed any cost that you might spend on technology in order to automate the process and be able to look at 100% of your data. So don't make that mistake of not doing nothing. Do something, even if it is a manual review of the data. Put some process and procedure in place that allows you to look at it. If you don't know how to look at it, get your EHR company or whoever that third-party firm is to come in and sit down with you and spend some time with you, helping you to understand the codification of their system so that you can look at it and read it. We've seen some companies that do some very sophisticated manual billing observations to make sure that they're getting all their billings correct. You might be able to cross-train those same people who are doing that to look at the audit logs of the system and do some type of a spot check. It's an option that you can take advantage of. And then, of course, you're going to ask yourself, well, how much and what percentage should I do? We've seen the OCR and the CMS audits on our side of the fence. Typically, it's going to be greater than 50% audit review that's taking place that they want to see. How often? It really depends on how clear your process is and whether you're doing it regularly. So if it's once a week, then it needs to be an intense, 1 day out of 5 where you're looking at all of the systems. If it's once a day, that's great, and it needs to be maybe 2 hours a day. And if it's once a month, you're going to fail. Guaranteed. You're just not going to pass. They're not going to accept that. There's no way for you to know and remember and to get everybody in your staff to recall what they did 30 days ago. It's tough with the patient flow that you have in your offices. It's tough to remember who came in a few days ago, let alone yesterday, and a month ago is just impossible. Having an automated solution that looks at 100% of that is going to be much more effective and allows you to do a much greater drill down in terms of granularity. So obviously, I'm biased here. I admit that. You want to look at the application level, you want to look at the network level, and you want to look at the device level to make sure that you're covering all of your systems. The next thing you may ask is, how do I pay for this? The money from HITECH is gone, the program is over. Maybe there's a few people who will attest this year and get some additional funds, but for the most part, the subsidies are gone, and I'm going to have to start paying for this myself. Our product, we work with partners across the United States, as Jill mentioned at the beginning, tends to average at about $80 a month. It really depends on how my partners are going to market with this. That's $80 a month to cover all of the systems that you have in your office and review everything. So if you have one system, it's 80. If you have 4 systems, it's 80. And that's per provider. So if you have 2 providers, it's 160. Just as an example, if you were to look at 100% on your own, and assuming a California average rate of about $18 an hour for the employees here, then you're looking at $266 a day. And if you only review 20% of that on a month, which may be passable, that's $1,000 a month. When you compare that net yearly, net contract, you can see the numbers there. It's just really not beneficial and cost effective for you to have one of your employees spending time looking at audit logs when you can spend a nominal fee for them to have 100% of all of those systems reviewed for you. And again, the number one thing that our clients push back to us on is, I want my people focused on patient care, not on technology. So if I can automate for a nominal fee, that's a much better solution for me, even though I hate paying you guys anything, and I get that too. A nominal fee is a lot better than zero. Doing nothing really isn't an answer. So a few examples, if I may. The first one here is a small practice in Florida who just recently came onto our system. They have been part of the high-tech program, worked with the local rec over in southern Florida, and they did their first SRA in 2013. They had not been audited. They saw us on an organization similar to Jill's. They learned about our product and they brought that on board. You can see that they're using eClinicalWorks. They have it hosted on site, so we're actually able to pull the audit log from their system with them on a daily basis. That's being uploaded into SPHER. And then SPHER is taking a look at that. And if they have an event, an incident that is recorded, that's been sent back to them. To give you guys an idea, in our world, there's usually about one incident every 7 days for a practice of this size, right? So imagine the needle in the haystack if you're doing that manually, and then determining whether or not that incident is in fact a breach. And if it is a breach, then you got to go back and you got to look at that employee or look at that patient record and go back in time and determine if that's been happening before that. At a medium-sized critical access hospital that we're working with in the state of Arizona, here they have about 15 providers in this organization that are supporting the hospital, but on any given day there's only 6 positions that are available. So the way we structured this deal for them on the MedHost environment was they pay for 6, not for 15. We don't charge for staff with our product, so whether they have 100 staff or 1,000 staff, we don't care. It's all based on the provider. They did complete their SRA, and we're able to work directly with them and support them. They use a free tool down here. It's called Splunk. That allows them to monitor their network. Some of you might be interested in that. Again, I can provide you with more information on that company. I don't resell that product. It's a great product. You might be interested in it. And there's some interesting things that you can do to monitor and keep your costs at 0. So I'm more than happy to point you to where you can spend nothing and still get a more sophisticated solution. For FQHCs, we have a number of these across the United States. This is a fairly large one in the state of California. About 13 FTE providers there. Again, eClinicalWorks, so you see there's consistency here in terms of some popular products. Again, there's Security Risk Assessment 2014. They outsource to a different product called Leidos, which is a very large, expensive product. I don't necessarily recommend the Leidos product to everybody. Splunk probably does as much, and it's free. Leidos is going to cost you a lot of money. But if you're looking to monitor the network level and also the application layer, then these are solutions that are available to you. And last but not least, Dallas, Texas, which we all know has been in the news quite a bit this last week. I will tell you that it's not that hospital. And we're working together with them. That is with the Epic system, so we're all familiar with Epic. Some people like it, some people hate it. We're pulling information from there, and we're monitoring all of their departments with our product and allowing them to determine where any type of anomalies are occurring within their system. And again, you see a very sophisticated tool with HP ArcSight being used at that layer. I apologize for the high-tech technology kind of talk, but as you get into larger organizations, you find that the technology becomes much more sophisticated. So the benefits of any type of an automated system, not just ours, but there are other really great products that are out there in the market, is you want to pay some nominal fee to get 100% coverage across all of your PHI systems. Knowing who is accessing your PHI is important to your business. I want to continue to stress that to everybody. You want to be HIPAA compliant. I know HIPAA is like a thorn in the rear, but it's important for your business. It's important for your reputation. It's important to your patients, even if they don't know that right now. They're more interested in you taking care of them. But as they hear and read stories about Home Depot and Dairy Queen and Target and every other retail store, at some point, somebody's going to start saying, what about the healthcare industry? And why aren't we seeing any stories about theirs? And if the media starts to catch on to those, then it's going to create the same type of panic about people and their records and the cost of those records. I'll share a little anecdotal note for everybody. A record from Target was worth about 50 cents per record on the open market. A record from a healthcare company, if it's stolen, is worth about $50. So if you're a bad guy and you're looking to steal a record, where are you going to go? And this is the biggest concern in the healthcare industry, or it should be one of the major concerns. You're going to see a lot of events in the end of 2014 going into 2015 where people are focused on those numbers and the fact that healthcare is becoming a really big target for the people who want to conduct identity theft and then sell those records to third parties. And those third parties are here in the United States. They're not overseas. They're not in Asia. They're not in Eastern Europe. They're in the United States of America. And that's what we need to be concerned about from a PHI perspective. I put together another checklist. I had one at the beginning that I want you to use. And here's another one. When you're looking at a solution, whether it's an automated solution or even a process that you put in place for your practice, you just ask yourself, is it compatible with the current systems? Are you knowledgeable of the current systems? Have you been trained? I mentioned this before, but ask your providers to spend 20, 30 minutes with you, helping you to understand what those audit logs look like and how to read them. Make sure it's easy to use. Make sure the interface is simple so that you or whoever you assign, your compliance officer, your security officer, have the ability to interact with that application easily, that you can follow the workflow and determine whether or not an incident needs to become a breach. You're going to want some reporting capabilities so that you have a record of that. So in the event that you get audited at a later date, you can pull those records out easily, both online and in paper, and present that to the auditor or to whoever comes into your office and starts questioning. It could be a lawyer from a patient who feels that some malfeasance is taking place. Multiple systems capable. I stress this. I think this is the strength of what we do. So multiple systems, multiple sites, multiple users. You shouldn't have to pay X times whatever just to have multiple systems covered in your office. I don't think that is required in today's technology. The technology is sophisticated, and the advantage should be to the provider in terms of that. And finally, is the contract flexible? You've all probably negotiated contracts with your EHR company. You've been through that process. You know what you like and what you don't like. Use that same logic as it relates to negotiating a contract with the partner that you choose. So I call this one the dreaded sales slide. I know I've been kind of talking about my product, but just 1 minute on it here. Our product is called SPHER. SPHER is developed to allow providers in both the ambulatory and the acute space to monitor what's happening within all of their ePHI contained applications. We do provide user activity reporting. We have graphs. We have metrics that are built into the system. It's very similar to what you're used to with your credit card. If you live in Maryland and all of a sudden you get a call from the Visa people saying, did you just buy something in Phoenix? And the answer is no, they're going to shut your card down. We're using the same type of technology to track the users in your office. And we can see their workflow. If they do something different, if they start looking at a large number of records where they've never done that in the past, we're going to flag that, bring that to your attention, and allow you to determine whether or not that incident was in fact a breach. We send out regular alerts to each of you, and we can lead you down the path to breach detection. And last but not least, the product is 24/7. So as long as you're uploading those logs into our system, we're reviewing every 24-hour period within your office and your operations and allowing you to have 100% coverage across all of your systems. So that's my pitch. I'll answer more questions on that if somebody has a question later. Let me summarize what I've gone over then. Bundle. You already have implemented security into your office. You probably have a firewall. You probably have some type of a password policy, which nobody is following. Everybody keeps using the same passwords. Try to change them at least once every 3 months, please. It would help you. It helps your office. It keeps you a lot safer. But look at a total package of not only just protecting from the outside, but how do I protect from the inside? I made that position that 67% of all the theft is from inside. So that firewall is not going to stop your employee. The firewall didn't stop Mr. Snowden from stealing information from NSA because he was inside the NSA. He had access. He was a trusted employee, and that's what we have, trusted employees who work for us. And unfortunately, they're the ones taking our information. Look at the guidelines. understand which guidelines apply to your business, and then ask yourself, what have we done to meet those guidelines, right? You don't have to be the hero. You don't have to be number one at everything, but make sure you're addressing all of them. I do recommend getting the security risk assessment done. And then what needs to be protected? Look at those systems. Do a walkthrough of your office. Automate when possible. Remember, it's a law. Remember, the concern is internal. Protect your practices internally and get started today. The last slide has my contact information on it. I'm Ray Ribble at allmedicalsolutions.com. My phone number is at the bottom there if you call and ask for me. Again, I would just say let me know that you were part of this call today, and that way I'll know how to calibrate my thinking for you and help you if I can. With that, let me pass it back to Jill.
Well, thank you so much, Ray. This was a very informative presentation on the need to monitor e-PHI access. If you have any questions for Ray, please use his contact information on the screen. And as I said, our team at First Healthcare Compliance, we're available to you at from 9 a.m. to 8 p.m. Eastern Standard Time. Please call us if you have questions or would like to schedule a quick demo of our software. Thank you very much.